So if y'all don't mind, I'm gonna, because I'm not here for any really official capacity, other than to say it is wonderful to see my friends in Wakefield. I miss you all, and in some respects wish I still had my old job, but off we go. But what I do want I want to thank everyone, because I know how hard Ruth's been working, and I know both communities have been doing a tremendous job, cobbling together, building some stuff from scratch, reacting to something that we didn't see coming. And I know, with the exception of Carol Ann, this is not what you expected when you all signed up or got elected, to serve in this capacity. And it is very, very much appreciated. I can tell you, because I do have the opportunity to speak to folks, across the Commonwealth, both my old job and my new job. You guys are doing a hell of a job, and the folks that are working with you and under you are as well. And that makes all the difference to the community. And I also just wanted to take a moment to introduce the newest member of the Melrose Board of Health, Carol Ann Lasitra, who from my perspective is in your lower left, but I'm not sure if she is anywhere else.
This is me.
Welcome.
Thank you.
She can
Thank
share
you.
with you.
Welcome so much.
I think thank you, right?
That's right. Careful what you wish for.
Yeah.
But her background is unique and extraordinary, and brings a dimension of mental health expertise to the table that is always needed, but certainly now more than ever, as we see what folks are going through, and quite frankly, some of the long-term implications of this, with the subtle traumatic stress that comes with this and doesn't go away even when we reopen. So Carol Ann, thank you. And also to the folks on here that are nurses, it is National Nurses Day.
Oh, yes.
Oh, that's right.
A special shout out to you all. And I know there's a lot of school nurses or nurses working in the schools that are involved in this effort. Please don't be shy about thanking them. I know in both communities, they've done a tremendous job shifting gears and doing what's needed. And that's, when you're in public service, that's the best thing you can do. So thank you all. I'm going to sign off because I need to get on to another one of these, but it's great to see you all. And I look forward to seeing you all in person under better circumstances. So have a great night. And
Without
again.
masks.
Oh, thank you.
Yeah.
You bet.
Bye.
All right, 7:09. Melrose will open the meeting.
And Wakefield will do the same.
In attendance is Frank Branchero, Carol Ann Lasitra,
Lasitra.
I'm sorry,
No problem.
and Maureen Garapay.
And for Wakefield, we have Laurel Gorville, Candace Linehan, and Elaine Silva.
Editorial note for Carol Ann that you need to get sworn in by at the city clerk's office. So give them a ring, and you'll have to make an appointment because
Sure.
the building's locked.
Okay.
And you can come in and get sworn in.
Okay. Thank you.
And I'm at the office most days, so we can meet up then too.
Okay. Thank you.
Ruth, just a technical point. Can she vote today, or does she have to be sworn in first?
Technically speaking, she has to be sworn in.
Yeah.
If you want to be picky about it.
Sorry.
But that's a perfect segue to the minutes,
Uh-huh.
which you wouldn't vote on if you weren't there anyways, so that's okay. Would you like me to share the minutes on the screen for you to see?
Yeah. Would that be something? Yeah. I'm not that familiar with how this all works, but if you could share it and I could see it while you're discussing it, it'd be
Sure.
great.
Either that or my pathophys notes. Oh, look, we got to the right one.
Oh, great. Thank you.
So these are the minutes. I'll just roll them up a little bit. And I don't know if anyone has anything to say about them from Wakefield.
Well, I see that I spelled Frank's name wrong once, so I'll go back and fix that.
First for everything.
Yeah, right.
Took me several times, Frank, to get that straight.
I'm sorry it was so late getting sent out. I apologize. Okay, if there's no changes, you guys can make a motion to accept.
I'll make a motion to accept the minutes for Wakefield.
I'll second that from Wakefield. It's Candace.
All in favor? Yeah, all in favor. I'll do roll call.
Roll call.
Candace? All in
Candace.
favor? Candace?
Candace Linehan, aye.
Yeah,
Elaine?
Elaine Silva, aye.
Laurel Gorville, aye.
Okay, Melrose.
A motion to accept the minutes as presented.
And I'll second the motion. All in favor?
Panchero, yes.
Garapay, yes.
There you go.
Right. Do you want me to put the health director's report up or no, Ruth?
Oh, is that the next thing on the agenda? I thought the other stuff was on the
I
agenda
have no
first.
idea. I'm not looking at the, oh, hold on. I didn't pull the agenda. Jen, did you pull the agenda? Is that one of you?
The only piece of paper I didn't bring home with me.
Okay, the next thing is current order requiring face masks.
So, Laurel, I think you asked to bring this up again. Is that right?
Yes, there it is.
Okay.
Thank you, Jen.
There you go.
Yeah, so I just wanted to be, I just wanted to take the opportunity that, we got ahead of the state, but now the state has initiated a statewide face mask rule. And do we want both? My first question is ours fairly consistent with the state? And then my second is, does it make sense to have both, or is it confusing to have both?
So I looked at both for that very reason, and there seems to be two parts that are different. One is theirs is 2 and over, and ours is 5 and over. But since theirs is more strict, ours cannot be less strict. So in practically speaking, it's 2 and over. And the state also includes outside if you can't socially distance. So, we can just use the states. The only issue would be if they end theirs before you want to end yours.
Ruth, do we have an end date for ours?
Yeah.
Yeah,
Ours is-
sorry, go ahead.
I think ours was written as until we stop it, basically. There's no end date.
Right,
So just leave it open-ended that way.
right. I think it says at the very end until the Board of Health decides otherwise or something like that.
For the end of, yeah.
So, you can revoke it because the state's covers more than the local one does. I can't imagine that the town or the city would want it longer than the state. I understood going before because they're always so slow to act, but I doubt that you would want to have it longer.
Yeah, that would be my assumption. I'm just trying to avoid any confusion with how people are interpreting.
So then we should revoke
Yeah.
yours so that we just do the states.
And with the announcement that, that the state's rule, I don't want anyone to misconstrue this and say, oh, Wakefield lifted it, so we don't have to do this.
No, Wakefield's lifting it so that we're consistent with the
Consistent with
state.
Right. And all our signage can stay the same because
Yeah, that doesn't change.
well, and the Board of Health speaks for the Massachusetts DPH anyway, so we don't have to change any per order signage, do we?
Nope.
Elaine, what do you think? Do you want to entertain a motion?
I would like to make the motion to change it and keep it with the state. I think the more consistent you are, as people can do a lot of social distancing now. They're learning to go to a driveway, and that way it's right in it's the same in every single city and town. You're not going to have any confusion, and people are just going to come so used to it, no matter where they go.
Mhm.
They're going to keep it. They're going to keep it in compliance, I think.
So you want to make a motion to revoke the order?
Yeah, to revoke hours.
So it needs a second.
I can second that, Candace. I can second.
Okay, for Wakefield, all in favor?
I, Elaine Silva.
Candace Linehan, aye.
Laurel Gorville, aye.
Okay, 300. Frank and Maureen, how do you feel?
I think we should do the same thing personally. I think the state should supersede what we do.
Okay,
Yeah, I agree. Avoiding confusion is a good thing.
okay. Frank, you want to make a motion to revoke
Um,
the order?
Motion to revoke the Melrose Board of Health facial covering order in light of the Massachusetts, or in favor of the Massachusetts order.
I second that. You
So
want to
you can
vote?
do Roll call vote.
All in
Finchero-
favor?
Finchero says yay.
Garapay, yes.
There we go. Okay. So, moving on to the next agenda item, we had talked briefly last week about how some communities are doing orders that officially restrict visitors to multifamily buildings, apartment buildings, or condominium buildings that are elder housing. So we have already sent information for Wakefield, the apartment buildings that have more than 8 units. And in Melrose, I believe it was all more than 6 units. And they were sent I think 4 things. They were sent a sign that they could use that says no visitors allowed. They were sent some guidance from the state health department about how you would, if you wanted to restrict, how to do it. And I sent a copy of the CDC's cleaning guidelines as to how to clean for multifamily buildings. So I sent hard copies to everybody, and I've had a few email me asking for the electronic version, which I have sent to them also. So, I don't feel strongly that we need to require it. I feel like we've done some good education. I feel like in Wakefield, I'd like to get the list of maybe buildings with 5 to 8 units in it and also send it to them. Because we had 130 in Melrose and we only had 22 in Wakefield. So I feel like we're missing a chunk. So I'd like to add that. Any comments, discussion, or everybody's good with leaving it as, advising and education?
Ruth, what is a high risk? Are you talking senior housing?
Senior housing, yeah.
There are 130 senior houses in Melrose?
Okay, I was not clear. I apologize. The boards of health that are doing orders that would only affect elder housing. So that would be something like Steele and McCarthy. Melrose has a lot. Wakefield, basically only has one. But it would include the Cephalo House, those kinds of places. So that would be in order. But beyond that, I sent this information to all multifamily units as education for everybody.
And Ruth, did we use the housing authority to help us with this and distributing that?
So I sent it to the housing authority.
Right.
So I sent it to the owners of all of the buildings that have 8 or more units.
Okay.
So they would be able to, like the building on Broadway, they would be able to post all the information in their lobby.
Right. Yeah, I'm inclined not to add an order on top of that. I think my sense is that people are being super careful
Yeah.
in those complexes, but and many of them have just made their own rules.
Absolutely.
So
Ruth, can I ask, have we had a problem?
No, I would not say we've had a problem. We've had inquiries and phone calls about, I know there's somebody in my building that was positive. Why weren't we informed? Don't we have the right to be informed, and blah, blah, blah. So more of that, those kinds of questions, as opposed to,
Yeah.
and as I said, every building can make their own rules if they want to.
I think if we haven't had specific complaints about that problem, I think people
Right.
are ordered out at this point too. I mean,
I agree.
That plus the fact that looking at Malden's, they passed it back on the 20th of March. I mean,
Right.
we're on the far end of it now, I think, that we should be mandating all this again.
I don't disagree. If you remember last week when I brought it up as a point of information, so that because other boards of health had done it, I wasn't recommending that you do it. I just wanted you to know what was happening, in the other communities.
I think it's going to be very difficult to try to enforce it. If you were talking about apartments and condos, condominiums.
Right. So for in Melrose, the building that you live in, Maureen,
Mm-hmm,
the information, the hard copies of everything was sent to the owner of the building.
mm-hmm.
So they have it. I don't know
Yeah,
whether they use it or they don't use it is completely up to them. All right, well, we can move on. So the health director's report, most of it is for both of you, but in some cases, so for Melrose, our youth group, our substance abuse youth group, was one of 3 youth groups nominated for an award with the 84 group, which is the tobacco control youth group. And our group didn't win, but there were only 3 nominated. So it's really a great thing that they were nominated. So the mayor talked to City Councilor Eccles and put an order in for a proclamation. And they're going to do the proclamation tomorrow night. Wait a minute, something just happened to my computer. They're gonna do the order tomorrow night, the proclamation tomorrow night at their meeting, and we're working out the logistics of seeing about having the kids on through WebEx or what. So, it's unfortunate doing this remotely. Can't really give the kids the credit the way you would want to, but I wanted to let you all know that at least. As far as the PR stuff that we were talking about last week, I would have to say for Wakefield, and Jen, you're still here, right? Jen's still here?
She is. She's the one who's sharing her screen right now.
Oh, okay. Thank you. Anyway, my sister-in-law was one of the people out distributing the bags of masks today. And she said that, not only was everybody very friendly and very helpful, but everybody knew about it. Everybody knew it was coming. So I think that really goes to Jen and what a great job she has done in getting the word out in a number of different mediums, including the reverse 911, but also in the other mediums too. So I think that's working really well. Any questions about that? I'll talk about the mass distribution. So Wakefield did their mass distribution today, which went really well. I was down at the senior center first thing this morning. We did a temperature check of each volunteer. The only glitch on that was I couldn't figure out how to get it to change from centigrade to Celsius, so I was taking it in Celsius. We had about 80 volunteers. I think about 45 were from the school department, teachers, school nurses, Doug Lyons, head of facilities. So that was great. And I know they enjoyed actually seeing each other too. So that was kind of an added bonus. And then the rest were all volunteers. They were all given a map with their route circled and a sheet of instructions and a box or a recycling bin full of bags with the mass in them. And almost all were done today. I know there are a few apartment buildings that didn't get done today, and I think there was a small amount of homes that didn't get done. The vast majority were done today. I don't know. I know, Laurel, you got yours.
Yep.
Elaine, did you get yours?
I did by noon.
Candace disappeared for a minute, but
Can you guys not see me? I can only see the screen.
Yeah, we can't see you.
we can
I can only see
see,
the screen
we
too.
can see your wall, but we don't see you personally.
That's kind of weird. Okay. I'm here, of course.
Yes. Okay. Did you get your mask today?
Yes, I did. It was awesome.
Okay, perfect. So that's good.
There you go.
So fire and police did the apartment buildings and condo complexes. And I got some good pictures. So that was 50,000 masks plus the 10,000 masks that we did with the drive-through. Was that 10 days ago or this Monday? I've lost track of time.
That was
Anyway, whatever Monday that was. Oh, it was a holiday, so it was last Monday. So that was great, and Wakefield has received a lot of excellent statewide press. So the Boston press, I don't know if they're trolling our Facebook page or what, but they knew about it. And I was interviewed by NBC7 last night, and we did it outside at the Common, so that looked nice. It's because it was outside. And then this morning we did channel, I hate to say this, but it was Fox 25.
It's local Fox.
It's local Fox. We did that in the office through Zoom. That was shown today at 4 and 6. And then if you want to see it, you can go on their website and there'll be a link to it. The one last night on Channel 7 was brief. The one in 25 was surprisingly, I thought it was a lot.
Yeah, I thought so too. They didn't edit you very much from what I could tell.
Yeah, they used a lot of information. So anyway, it's all really good for Wakefield. Last night, I didn't see the Channel 7 one. Did anybody see the Channel 7?
No.
No? Okay. The Channel 7 one, I tried to make Melrose Wakefield. And I don't know how it came off. So I don't know if the Melrose part came off like the but I tried to make it a, over 100,000 masks being given out. I kind of thought that sounded really cool. So Melrose the tentative date will be Monday. They have 60,000 masks, actually more, 62,000 masks in hand. They're finishing up stuffing the bags. And they'll be doing pretty much the same process. It'll be volunteers and probably some city employees that will be delivering them door by door. And same thing, 5 masks in a bag, 1 bag per household. And probably they'll get through the same thing, probably almost all of them on Monday and finish up on Tuesday. And we hope for good weather. So I think it's been a fabulous program. People have just loved it. Really good PR for Wakefield, really good PR for us in the health department, because a health department business card was stapled to the outside. So as far as, raising visibility for us, I think that worked out really well. And in Melrose, it will be the mayor's welcome piece of paper stapled to the outside, but that's just the difference between being a city and a town. So, and we also did put in a interface business card in almost every bag. And I feel really good about that, because, that's something you can stick on the refrigerator or stick in your wallet. For, as the mayor said earlier, behavioral health is going to be even more and more of an issue. And I'm really glad we were able to get that information out, really basically to every single household. So I'm really happy about that. Any questions about the mass distribution?
No, it was well done. And it occurs to me as well that it just like our flu vaccine efforts are sort of a drill in emergency management, I sort of feel like that was as well. Like if you really had to get stuff to every household quickly, it was amazing to see.
It was. And both Melrose and Wakefield are very community oriented with, a lot of community volunteers. So, as far as emergency planning and thinking about using postal service to distribute something, we're in really good shape for this. And this was a great exercise. It was very successful.
So can we, Jen, I'm wondering if we can just pop a note back to the item and maybe even WCAT, thanking our volunteers for participating in that drive.
Absolutely. There was, I think there were maybe 4 or 5 days of stuffing and folding, and the senior center staff worked all week. And obviously the folks who walked around, it was a huge team effort.
So that
and Jen, I did take pictures today, which is what 25 used on their broadcast, and I did mean to send them to you earlier today, and I forgot. But I have a great picture of Steve giving the information to Doug Lyons.
Nice.
That was good. And I have another really good picture of Steve and the 2 chiefs. And I have a picture of the teachers lined up all through the parking lot. So I will forward those pictures to you.
Excellent. Thank you.
Set that to music. It would be a hallmark moment on WCAT. We could.
Yeah. Well, and I know that Judy was taking pictures of the stuffing parties too. So yeah, really. I mean, it's good. It was really good.
Party in quotes.
Yeah. Get together, whatever. So just following up on the behavioral health part, and it's not in my report because we're in the middle of doing it. Well, actually, we're not in the middle of doing it at this point. So one of the Melrose school nurses who lives in Stoneham, the town of Stoneham offered a webinar to parents of teens on behavioral health issues for their adolescents during this quarantine. And it's called Teens, Tweens, and Quarantines. Cute. So she did it and she loved it. She thought it was wonderful. So she sent me information about it and said, can we do this in Melrose? And I said, of course, hell yes. So it's the high school nurse, Susie Minsk, who's been coordinating this. And it is scheduled for Melrose, May 14th, 7 o'clock at May 14th, on May 14th. A flyer will be going out through the school department to parents of everybody in the middle and high school. And you'll be able to go on through WebEOC. And we personalized it to Melrose by putting the Melrose YRBS information on it, not the statewide information, things like that. And so then, of course, I sent the same information to Catherine, who shared it with the school department, and they were also gung-ho. Catherine's done the same thing, and Wakefield is now scheduled for 7 o'clock on May 11th. So I am really excited about this. It was $500 for each community, and I was going to use my COVID money to pay for it, but we do still have substance abuse money for events that were going to happen that now aren't going to happen. So we're going to use the substance abuse prevention money to pay for both of them. And let's see, some of you have teens. Frank, do you still have teens, Frank?
Yeah, I get a 16-year-old. She'll be 16 next week, I think.
Oh,
That counts. That counts.
And I think he's 18. Yeah, he's 18.
So I think
The emails went out. We received, I have a teen also. They sent 2 emails already from the school about
Yay!
the event. Yeah.
yay. All
Yeah,
right.
my wife knew about it somehow. I was wondering, that's probably what it was. Yeah.
Yeah.
So for those of you who don't have teens, for Melrose and Wakefield, I will get the flyer and send it to you so that you can log on if you want to and hear about it and watch along. So
it came through the Wake Up network as well. So I already signed up for it.
oh, good.
Great.
So Ruth, excuse me, is this going to be on MMTV? Or is it on a website?
It is going to be a webinar.
Yeah.
So I would have to ask the guy that's doing it whether he allows his ones to be put on cable TV. He might. He may not. I don't know. But I can follow up and find out.
But for this go around, you just register access. You register, you give them your email, and then they send back some kind of access on that Monday night, on the night that your town is doing it.
Oh, all right. Okay. Thank you.
But if for people that, aren't available at 7 o'clock that night or would be able to see it at a different time, it would be nice if we could tape it. I know that for Melrose, WebEx has a maximum of 1,000. I'm not worried that we'll have more than 1,000. It would be wonderful if we did. And I'm not sure if there's a limit with Wakefield. But I will find out if WCAT and MMTV could, where's my pen, could tape it and rebroadcast it. Because that would be wonderful.
If it's something we're paying for, are they less likely to want to tape it then?
I don't know. I can ask, you know me.
I'm sorry if I missed this. Who's the person who's actually doing it?
He's a consultant. His name is John
Metalman.
Metalman.
Settlement?
And Catherine already knew of him from other trainings she had done. So he came well recommended, and one of our nurses had already done it and really liked it. So we'll see.
The email that I received says it's a Zoom info to follow. So I don't know if that's more accessible for people, but
Zoom.
yeah, it says Zoom info to follow.
I think that's a mistake. it's going to be
Might have
WebEx.
been okay.
You know what? Zoom might actually be one of those words like Kleenex.
Right, right. Or Google it, Zoom it.
Google
Yeah.
it,
Mhm.
Kleenex. I think
Okay.
it might be boat meeting like, but Melrose uses WebEx and Wakefield uses Zoom. Just to
Okay.
torture me, but that's the way it is. So I'll be very interested to hear how you like it, how you feel about it. So
So are Carol Ann and I the only ones who have teenagers?
In
Yeah.
Melrose, yes.
and Melrose, yeah, everybody else's kids are older.
I have teenage grandkids. Does that count?
Yes, it does.
I
Yeah.
have 2 teens.
Not in Melrose, you don't.
Well, almost tween, 12.
Me?
He
My
is
boys are in
not.
Melrose.
Is he a tween already? How can that be?
He is.
Oh my God. Yes, Cindy also has. Oh, Cindy, your kids are in high school and college.
But they're still teenagers.
Yeah, but they're in college.
Okay, bye.
But we'll give you the link in case you have nothing to do and you really want to watch it.
And what is tween, like 11, 12?
Well, the Galvin Middle School starts at grade 5.
Oh.
So they're tweens, definitely. And I don't know if 6th grade is considered a tween or a teen, but 5th grade definitely is a tween. So for Wakefield, it's 5 through 12, and then for Melrose, it's 6 through 12.
That's quite an age range. I wonder how he's going to really engage that larger group, that larger range of ages.
I think that's a really good question.
Yeah.
There's a big difference between 5th and 6th graders and 11 and 12th graders.
Especially now, with keeping them occupied or motivating them in different ways. I'm looking forward to this. So if I can report back if no one else attends. So
No, I'm sure the others
Yeah.
will too, but an adolescent mind is still an adolescent mind. Some are more sophisticated than others, but so anyway, so that's an added bonus that was a surprise, but I'm really, really pleased that we can do this. Face shields, we've had about over 200 face shields that have been made on 3D printers and donated to us through our Medical Reserve Corps. So we've been offering them to our long-term care facilities who have been thrilled. And well, actually, I have to update. So no, never mind. 93 includes the 12. I just did another delivery yesterday. So yeah, so 93 to Melrose, more to Wakefield because their facilities are bigger. And I just got another delivery at my office. So unfortunately, they need to be assembled. I know some communities are just giving them to the long-term care facilities and telling them to assemble it. I feel like they're already so short-staffed that I'm not sure they would use them if they weren't assembled. So I'm trying to have volunteers assemble them before we deliver them. And we also had a whole load of lab coats donated to us. And so we also distributed lab coats because gowns are in very short supply. And so we gave them those too. So that's been good. And as of today, we have translation services in place, both communities. I think it's like 100 different languages that with our contact tracing and case management, if they come across a person that English is not their first language, they can bring a translator online. So the 3 of them are on the same phone line and the other person will translate. So that's huge, huge, huge. I'm really excited about that. And the best part about it for now, it's free. The state pays for it.
Oh, good.
I would like to keep the service afterwards, and we'll talk about budget time, maybe being able to keep it, because I know sometimes, well, definitely with food service, we have issues with Chinese and Portuguese primarily. And for housing, all different languages for housing. So I'd like to be able to keep it and pay for it even after COVID-19 for other purposes. So, and I think I told you the Melrose resource masks are going out in English, Chinese, and Spanish. No, is that right? Yeah, that's right. That's right. Those are the 3 languages. So I know statewide, being able to address everybody in the state, no matter their ethnicity or their language, is a big push. And I think this is a huge step for us.
Well
So,
done. Have a glass of water.
I think that's it. Cindy, what did I forget? Well, she's either muted or not listening.
No.
Cindy, did I forget anything?
I'm gonna
Not
unmute
listening.
her.
Okay. We are coming up upon license renewal season for food permits. Melrose, they expire the end of this month. Wakefield, they expire at the end of next month. Coral, Cindy has been working with Coral and whoever the Wakefield vendor is to be able to transform everything online so that they can have fillable forms, they can attach the attachments and pay online. So we're hoping to have that in place. It may or may not be in place, ready for June 1st, but we've made a lot of strides on that, which is great. Melrose is in the process of doing that. The Melrose City Solicitor has told us that there's some law that says that all permits now have to go through the city clerk. So we're trying to put that in place, but it's really not ready, and ours are due the end of this month. So I'm working with the city solicitor so that we can do it ourselves, because we haven't sent our renewal notices out yet, and we're later than normal. I don't want to have to change the deadline and everything, because that just makes everybody confused. So, but anyway, within the next 2 months, license renewals will be done. I wanted to bring up a concept for you of prorating licenses, which traditionally we don't do. Traditionally, the policy of both boards has been, unless it's the last month of the license year, in which case, yeah, we'll do a 13-month license. Besides that, we don't prorate them. So I wanted to bring it up because obviously not all restaurants are open, but as it turns out at this point, most of the restaurants are open. So I just wanted to bring it up as an idea as to whether for restaurants that are going to be remained closed, we don't know when the governor is going to allow restaurants to reopen and in what form.
How hard is it? How hard is it on administration to do that?
To prorate it?
Mm-hmm.
We just figured out. It's probably not, I know the numbers are not divisible by 12, but we'll do it the best we can.
Mm-hmm.
So if they're, not planning on, if they're closed now and not planning on reopening till September, they would get a couple of months cheaper fee. Places like Billy's Roast Beef that has been closed is planning on reopening on Monday. I can't even think of places at this point. Sabatino's is open, Cafe Italia is open, Harrington's is open. I know this because we've been doing takeout. I'm not sure about Artichokes. Has anybody done artichokes?
I think they're still closed.
Okay. The ice cream places are open, Sakura's open. Both of the, Giacomo's and Public Kitchen, same owner. They were closed, but they've reopened. So I don't think it would really apply to too many. But, if it would apply to somebody, it's not like our fees aren't very much anyway. They're like $100 or $150. On the other hand, the food industry is taking a really big hit. So if there's anything we can do that would help them, I'm sure they would appreciate it.
Yeah, like I feel it would be a goodwill message, and like, let's give everybody any break that we can, even if it's, more symbolic than anything else. But it's really, this is just an operation matter. We don't have to vote on it, right?
No, it's part of our fee structure, but we're not talking about permanently changing it. I would consider it a policy just for this year because of special circumstances. So I'm going to go with concurrence works for me.
Mhm.
Can everybody, like, Frank, are you okay with that?
Oh, yeah. Yeah.
Maureen, are you okay with that?
Sure.
Laurel,
Yes.
Elaine,
Yes.
Candace,
Yep.
Carol Ann, you're not official, but we'll ask you anyway.
I think it's great. The goodwill part of it especially, I think it's great.
Yeah, I think so. The other thing I've been doing with the restaurants in particular is some of them have been asking for masks now because their shipments, their orders haven't come in. And we also, when our local one went into effect, we offered to give places masks to hand to customers. So we have done that, and we've gotten a few more calls lately because a few more places have been opening. So we have saved out some of the masks to give to businesses to help them. Like Billy's Roast Beef was told that their order isn't going to come in till the end of next week, and they want to open on Monday. So I said, well, if you want to come to the office, I'd be happy to give them to you. So they're doing that. And the school department has gotten masks from us because they're doing food lunches and stuff that they're giving out. So I think we've been doing everything we can to help them.
Agreed.
So I think that's it for now. Pretty much 100%, all right, 99% of what I've been doing is COVID. We had one chicken applicant that I dealt with, one swarming bees that I dealt with, but pretty much all the calls are COVID-19 at this point.
And mosquito spraying happened or is happening right now.
Oh, yeah, yeah.
I didn't have time to double check. It was definitely scheduled, and I don't know why it wouldn't have happened because the weather has been fine.
Yeah.
Yep. It's mosquito time.
Ruth, could I bring up something for Melrose anyway? That thing that we put in the advisory for the curfew.
Right.
Can the minutes come off or whatever that is off the board? Is that on everybody?
Jen, can you take that off?
Well, hold on a second.
Wait a minute.
Jen doesn't amend the minutes. Cindy and I do, but where?
No.
He was sharing.
No, it was the thing on the page. So the thing that we put in with the curfew, that's outdated now. That ended on the 4th.
Did it say that we ended
Yep.
it on the 4th? Oh,
Yep.
okay. Well, there you go.
So what do you think? Is it just done with, or? The only portion of it would be the curfew that would have been any.
Well, if it's expired, it's expired. You would have to
Okay.
revote it or decide you want to extend it.
I never heard any kind of comments. I haven't heard any comments as to whether it was working or not working or worth.
I didn't get any
worthwhile.
feedback either. I didn't get any.
No, I did see some feedback somewhere where someone was saying, in the interest of social distancing, this doesn't make sense. I go out and walk late at night or early in the morning in order to avoid people. I think, if I recall, when we passed that, we were kind of following Boston's 9 to 6 lead.
Right.
And I think it was a matter of keeping the streets free so we didn't need as many, and public services type thing. Am I remembering that correctly, or does
I think so.
sense?
Yes. I don't see any problem with letting it expire.
I think that's fine too.
Okay.
Now Boston still has theirs, right? And I think when we did this,
Yes, they do.
there was a lot of other locally that did it as well.
I don't know if it's as much of an issue in suburbia here with us.
Yeah. So what do people think? I don't know.
I'm fine with letting it expire at this point. If it gets really bad, then we may have to rethink it, but hopefully with the good weather coming, it will still help.
Yeah, for quite a while now, you go out at 10 o'clock and it looks like it's 2 a.m. anyway.
It's true, yeah.
I just think it,
Yeah, I think we have to think about too when things start to reopen.
Mm-hmm.
It's even if you say 10 o'clock, a lot of the restaurants still have pickup till like 9 o'clock.
Yeah.
I don't think most people have even thought about it. They figure just don't go out at night. It's the weather's been in our favor. It hasn't been that great, in my opinion. But
You're right.
Maybe we should just let it expire. And like you say, I think if we run into a problem, if there is something else that pops up, but once places start to open, they're going to be open till 9:30 or 10. So you don't want people in violation of doing that too.
And not only that, but I think people that are runners and want to get out early before work, as the good weather comes, they're going to be out at 5 o'clock.
Yeah.
Yeah, or they're going to want to be, and it's light by then. So I think it's reasonable to let it expire.
Okay, I'm fine with that.
Okay, good. I, for one, will be very happy when some of these places open up again, but that's just me.
I'm with you.
I'm with you too. Ruth, this has nothing to do with COVID, but Crystal Street.
Yep.
You don't know what's going on with that, do you?
I do, actually. I do. So because it's next to the lake, he has to, before he demos it, he needs to go through conservation. So he is waiting for approvals through the Conservation Commission before he can do his demo permit.
Who is he? Was it sold?
Oh, I'm sorry. Yeah. Don, sorry. Don Stead bought it.
Okay.
So Don Stead is a longtime local developer. He owns a lot of property. He lives in Linfield now, but he's a Melrose person. He owns a lot of property, a lot of commercial property, and some residential property in Melrose. And he purchased it cash and is taking it down. But there's a lot of hoops to jump through because of its location. So his intention is to take it down as soon as he can.
The only reason I brought it up is because I happened to walk by there today, and the fence that goes across in front of the driveway is opened up, and there is like access to the water.
Okay, I actually have his phone number. I can give him a ring and just.
I was thinking that if it was city property at this point, because I didn't know where it was, that it might be a liability. So that was my concern.
It was about 15 minutes away from being in receivership.
Okay.
But they avoided receivership because they got a P&S signed at the 11th hour.
Well, I was a little bit nervous with the opening that might go down to the water
Yeah, no, I'll let Don know.
Okay,
City made a lot of money on that because of the liens on the property, so it's a good thing.
good.
Any other issues about things going on?
No,
Oh, Laurel, you had wanted to talk about whether you wanted to go to every other week or continue with every week.
what do you think, gang?
I'm thinking
Feeling
about
like I'd like to
myself.
give Ruth a night off.
Yeah.
I have 6 nights off.
I know. I'm wondering if we should just do it till May 18th is supposed to be this big miracle day.
Good point, yeah.
You know, if we just do it till then, just in case there's something coming from the governor that we're gonna go like, oh my God, we need to do something about it. And then after that, I think it's time to take a break for everyone.
Yeah, our regularly scheduled meeting for Wakefield is the 20th.
Yeah.
So,
Wait a minute. No,
isn't it?
the next one would be the 13th.
No. But I'm saying before COVID, when we did it monthly.
Oh, okay. I know. Okay. I thought you meant.
Like it's already in my book. But no, I'm happy to go. I really, Ruth, I wanted to just get your sense. I think that we've, enough has happened every week. We may, if there's any kind of reopening plan, we actually might get busier because people are looking for guidance, and it's not all going to come from us. Hopefully most of it will be state driven, but we're going to hear about it.
So the state is working on reopening guidance, and town hall and city hall both have groups also who actually literally have just started yesterday. Wakefield had their first meeting and Melrose had their first meeting today to talk about reopening city hall and town hall and how that will be done. So I think in the general businesses for like hair salons and blah, 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 that's going to come from the state with their guidance. And then the municipal buildings we're working on.
Okay.
Because we definitely, we want all the hair salons having the same guidance.
Same rules.
And we definitely want them open. They're going to be working nights, 24 hours.
Exactly.
Just for a month.
This is not a good look. Not a good look.
I think it's actually going to get busier now because when everything was like black and white, now there's going to be a lot more gray and trickier than what we've been doing the last few weeks.
Yeah, you're right. Wishful thinking.
Yeah, there is.
So we'll stick with next week?
Sure.
Wednesday?
No problem. And we'll do it through Zoom again. So once Wakefield sets up the Zoom, then what we do is we, cut and paste it somehow onto the Melrose agenda so you can do it, click on and it goes on. Don't ask me.
When does it get on the Melrose website? Because I emailed you about this, but I couldn't find it I think as late as yesterday.
Ooh.
The Zoom meeting on
the agenda was on though, right?
The agenda was.
Okay, so I sent the Zoom part to the city clerk's office to put on, but I didn't double check to see, did they do it? I'll look to see whether it ever got on. It may have been on, it may have been put on after. Because what happens is, what's been happening is we've been meeting on Wednesdays, and so Wakefield, we post Wakefield sometime on Monday, and I make sure to post the Melrose meeting on Monday so that we meet open meeting law. But I'm not as worried about the Zoom information as getting on there Monday because that has to come after Wakefield. But I make sure that the meetings are posted. But the Zoom information should be on Tuesday.
Okay.
If it's not, tell me so I can do whatever I need to do to make sure that happens.
Okay.
Can Cindy just send it to everybody when she gets it from Sherry?
It does go to everybody from Sherry.
It does, yeah.
Yeah, I'm talking about the Melrose people.
No, that's what I'm saying, that Cindy could include the Zoom link.
Oh, to the Melrose board?
Yeah.
Yeah.
That's easy.
Why couldn't, that would be easy.
right? So
But you know what, Laurel, it has to be more than the board. The public has to be able to get on. So it has to be on the agenda.
Okay.
Just
Good.
realize that. Ugh.
That's great.
So once I do the agenda, the Zoom meeting is, once we post the agenda, it's with the Zoom meeting. And that has to be done by Monday for open meeting law. So
Right.
you'll have the same information for Melrose on Monday after I have it.
Right, but sometimes it's later in the day. And I make sure for Melrose that the meeting is posted, but the Zoom part isn't always posted on Monday because I'm paranoid about it not getting posted on Monday. I post the agenda right away. And then I wait for the Wakefield Zoom and then add it on.
Okay, so once I have my agenda, I can just share that to everybody.
Yeah.
Yep, because I have the Zoom meeting info.
But I still have to put it on for the public.
Yes.
That's the issue. Okay, so I think we're good to go. Everybody good to go?
I'm happy to take a motion.
I'll take a-
Laurel, don't hang up right away. I have a question for you.
Okay.
I'll make a motion to adjourn the meeting for the Wakefield Board of Health.
I'll second.
All in favor?
Elaine, aye.
Laurel, I. Candace is putting her hand up. Aye.
Frank, you want to make a motion?
Yeah, motion to adjourn the Melrose Board of Health meeting.
And seconded, all in favor?
Ventura, yes.
Garapay, yes.
Yes.
Caroline?
Carolyn, we can't wait to put you in there. And welcome, by the way.
Thank you all very much. I'm sorry it's quiet, but
Everybody
No,
has-
fine. Carolyn, I'm going to contact